A concussion is a brain injury which can be caused by any bump or blow to the head, including small dings or getting your bell rung. Every sport is different, but there are some steps you can take to protect from concussion. Wearing proper protective equipment such as helmets, mouth guards, eye guards, padding. Your equipment should be fitted properly, well maintained, and be worn consistently and correctly. You can also follow your coach's rules for safety and the rules of your sport to avoid concussion or prevent concussion. Practice good sportsmanship and learn the signs and symptoms of concussion. Signs to watch for if your child has experienced a bump or blow to the head during a game or practice can include appearing dazed or confused, forgetting instructions, unsure of games, scores, or opponents, confusion about assignment or position, clumsy movements, asking the same question repeatedly, slow to answering questions, any behavior changes or personality changes. You know your children, so if something seems off, it's a big sign of concussion. Unable to recall events prior to or after a hit or blow, and loss of consciousness, and even briefly, can be a sign of concussion. Symptoms that they may report, that your child or athlete may report, are headaches or pressure in their head, nausea, vomiting, balance issues, dizziness, double or blurry vision, sensitivity to light or noise, feeling sluggish, foggy, or hazy, difficulty with memory or concentration, confusion, or just not feeling right. You can't see a concussion. Signs and symptoms can show up immediately after the injury, or they may not appear or be noticed until weeks or days later. If you suspect your child may have a concussion, there are a few steps you can take. Seek medical attention right away. A healthcare professional, such as a physician or an athletic trainer, can decide how serious the concussion is and when your child can return to play. And keep your child out of play. That's the second thing you can do. Concussions take time to heal. Do not let your children return to play until cleared by a healthcare professional. Children who return to play too soon while the brain is still healing can risk a greater chance of having a second concussion or more, which can then be very serious and cause permanent brain damage. And then tell your children's coach if they've had any recent concussions. Coaches should know if your child has had any concussions in any of their sports, not just the one they're playing under that coach. If you do not tell them, they may not know. And always remember that it's better to miss a game than the whole season.